You could go on for an hour on this one. All right. Dr. Morse, here's a question we got from one of our fellow New Yorkers. Are we more concerned about COVID-19 or flu in terms of new strains?
Well, we are right at the beginning of respiratory viral season, so we're worried about both right now. The challenge with viruses, of course, is that they do evolve and change. This is why it's so important to get the updated COVID-19 and flu vaccines every year. If you haven't done it yet, go do it right now. And I would say that at this point, we worry about both. When we're heading into respiratory viral season, it's pretty hard to predict if one of the 2 or 3 main viruses, RSV, COVID-19, and flu, are going to be most dominant and at which period of time. So that's why our recommendation is the best way to protect yourself, your family, and your whole community is to get the updated vaccines this season. So New Yorkers are also asking which of the viruses, COVID-19 and flu, is most serious.
And when you look at our data for New York State for 2024, COVID-19, we saw 2,775 people pass away related to COVID. We saw a little over 650 people pass away related to the flu. So we saw more deaths related to COVID, and we also saw a lot more people admitted to the hospital related to COVID as well. So COVID is more serious. Why do these viruses hit hardest in the fall and winter?
When it's colder outside, folks tend to stay indoors more. The more you're indoors with others, the easier it is for viruses to spread amongst people. We're also heading into the holidays, and the holidays are a time when people are traveling and hanging out with each other even more. That's a great place for viruses to spread, unfortunately. And then another thing is that it can be drier in the wintertime, and that dryness allows viruses to spread more quickly through the air and get into your eyes, nose, mouth, etc. much more quickly and easily.